Monday, August 17th, 2020. Joining us today is Mayor John Tory, and on the line, should you have questions, is Toronto's Associate Medical Officer of Health, Dr. Vanita Dubé. Mayor Tory?
Well, Brad, thank you, and good afternoon. I know that families across the city continue to be very focused on the start of school next month, and accordingly I'll spend quite a bit of my report today updating on our own role. It's provincially mandated, of course, and also the responsibility of school boards, but the city has been trying to help in any way that it can within the context of making sure that we have a safe restart of the schools in September. While the province and the local school boards are responsible for back-to-school plans, Toronto Public Health has been providing guidance to the school boards on these plans to ensure a safer return to school for children this fall and taking action to get ready where appropriate. A specific example of an action being taken by the city through public health involves recruiting nurses following the provincial announcement last week from Ontario's Chief Medical Officer of Health notifying public health departments across the province that they could now begin recruitment to provide nursing support to schools. We anticipate Toronto Public Health will establish a team of more than 70 nurses, including some experienced nurses and some newly recruited nurses, to provide strong support to schools as they reopen as part of the provincial framework plan. These nurses will provide education and training sessions to school staff, to parents and caregivers to promote infection prevention and control measures, and other public health advice so as to limit opportunities for the COVID-19 virus to spread. They will also be providing mental health and well-being support in these settings, along with outbreak investigation, case management, and will support the planning process for testing if a COVID-19 case is detected in a school setting. Toronto Public Health is continuing to plan for a second possible COVID-19 wave, school reopening, and providing critical public health services while, of course, carrying out all of the responsibilities they've had throughout this pandemic. While we're awaiting the exact details of the provincial announcement and the school board's plans, we expect we will begin by redeploying current staff and then recruiting additional staff as needed to scale up COVID-19 resources when schools reopen. Toronto Public Health has strong and long-standing relationships with our school boards and our schools and has historically provided this type of investigative and preventative guidance to schools for many infectious diseases such as measles and mumps and whooping cough. Similarly, for COVID-19, Toronto Public Health will rely on provincial protocols developed by the Ministry of Health and Public Health Ontario to provide guidance and expertise when a COVID-19 case is identified in a school setting. Toronto Public Health will conduct a thorough investigation for each and every case that occurs. After Toronto Public Health's assessment, school staff and parents will be informed of requirements to keep our children safe. These can include recommendations as to which staff and students should be tested or sent home to isolate in order to further reduce the spread of the virus. I understand that these protocols are being finalized and will soon be released so that all of the people out there in the population will be able to look at them and review them and obviously make their own comments and come to understand them better. Because we want to make sure, first and foremost, that parents and caregivers feel reassured about what we are doing as a city and doing that hand in hand with the school boards and with the provincial government to make sure that the return to school is safe for all kids and for all staff members. Toronto Public Health has also established a school team that will be responsible for the overall monitoring and support of schools once they reopen. We will also support and facilitate the planning process for testing in schools, and through consultation with schools, we will ensure that they implement proper strategies and procedures related to infection prevention and control. Our number one goal, and I believe the goal of absolutely every single person involved in this, whether it at the school board, whether it be at the province, or whether it be anywhere else at public health, is to keep our children as safe as possible when they return to school. The city, through Toronto Public Health, will provide as much support as possible to our schools because we know that a safe reopening of the schools is so important to the restart and recovery of the city, and most important, the overall well-being of our young people. And as Brad mentioned, we have staff on the line today, in particular our Associate Medical Officer of Health, who can answer questions about these measures that we've undertaken on the health side of things to be of assistance to the school boards and to the schools and to the province in their undertakings to get the schools open. Now, on a slightly separate front, staff from several city departments, including Parks, Forestry and Recreation, Toronto Public Library, Economic Development and Real Estate, are working with the Toronto District School Board and the Toronto Catholic District School Board to understand their space needs and whether we can help to meet them. I was given an extensive report on this work that has been ongoing for some time this morning. We expect to have a further update soon on city space and how the school boards could access it if they wish to access it. We're also confirming to the school boards that all of the city parks are open to their use and available for classes to use without a permit. I'm also pleased to announce that the city is preparing to offer fall recreation programs this year. Programs will be modified to meet public health guidelines and provincial restrictions. Torontonians can expect to see their favorite registered recreation programs, including swimming lessons, on offer this fall at city recreation facilities. This, of course, is being done with some limitations and familiar safety measures in place. Fall recreation programs will run with reduced capacity to allow for physical distancing and to ensure that people can safely participate, especially in indoor settings. Additionally, some programs won't be able to resume if, for example, they require the sharing of equipment or food supplies. Registration for fall recreation programs will take place from September 12th through to September 16th. More information about fall recreation programs and how to register will be made available later this month on the city's website, well in advance of the registration dates. I'm pleased also to say that staff recruitment is underway for fall recreation programs. Unfortunately, with some of the diminished offering that we were able to put forward this summer, and it was a feat of great proportions done by our staff to even offer the limited selection that we did, that resulted in some people normally who would be employed by us not being employed by us over the course of this summer. And the same may well be true in the fall, but there will be some recruitment taking place for these modified programs that are going to be offered in the fall. There are a variety of recreation positions available in locations across the city for aquatics, sports, skate, and art programs, as well as after-school and youth programs. And so I would encourage people who are interested to have a look online at jobs.toronto.ca/recreation. And so again, I'll repeat that, jobs.toronto.ca/recreation as a place where you can look at the employment possibilities that go with the recreation programs offered this fall by the City of Toronto. To complement the return to school for many Toronto children in September, the city will be offering after-school recreation care known as the ARC program for the duration of the school year. The Community Leadership After-School Program, known as CLASP, will also be offered. The ARC program offers high-quality, safe after-school recreation care for children in the age group 6 to 12 and runs Monday to Friday from school dismissal time until 6 o'clock in the evening. The ARC program offers participants a range of after-school activities in a caregiving setting, including sports, outdoor play, special events, creative activities, and homework help. The CLASP program is aimed at kids between the ages of 10 and 15, and it's designed to enhance life skills by promoting physical literacy, health and wellness, and community involvement through leadership workshops. In order to allow for physical distancing, smaller leader-to-participant ratios will be in place for these programs. They will resume with guidelines and procedures in place that are designed to reduce the spread of COVID-19. These are procedures which were developed in consultation with Toronto Public Health. Although the capacity of these programs will be reduced due to the public health requirements, we are hopeful that we can provide enough service for parents and caregivers who are looking for after-school care. Registration for the after-school recreation care program will take place on August the 24th. More information about after-school recreation care is available on the city's website at toronto.ca/ARC, A-R-C. The best way we can all help to keep our schools and children safe is to stop the spread of COVID-19 in our community by continuing to follow public health advice. That is why we put in place mandatory mask and face covering rules more than a month ago, based on the recommendations of public health to help protect people inside public spaces like stores and to protect people using the TTC. We are continuing to see good compliance with the rules, and I want to express my sincere and very genuine thanks to residents across the city for doing their part to help make sure that the face covering rules are followed. And I want to thank businesses as well for the important role they have played in communicating this information to their customers relatively without incident. So a big thanks to the people of Toronto, but also to the businesses of Toronto, because together they have worked in partnership with government to make sure that we are doing something that I believe, and more importantly than the medical officer of health believes, is fundamental to stopping the spread of the virus and to continuing us on a positive trend with respect to this pandemic. Compliance on the TTC remains very high, and we know this will be important as more and more people get back on the TTC and physical distancing becomes increasingly challenging. TTC staff recently did a count on the King streetcar, and this was based in part on a question that I received through the media on one of my appearances with respect to a particular streetcar line and supposed non-compliance there. What they found was that 96% compliance was being achieved on the King streetcar route, the busiest surface transit route in the city. That is excellent compliance. That is consistent with the kind of compliance that has been seen not only in other cities with face covering rules for transit systems, but also consistent with the performance on other parts of the transit system. And again, I want to thank the vast majority of people using the transit system for their absolutely superb compliance with the requirements that were put in place. And I'm now happy, through Brad, to deal with questions that I can deal with together with our public service colleagues.
Thank you, Mr. Mayor. So as I noted, in addition to the Mayor, we have Dr. Vanita Dubé, who can answer any questions from Public Health. And then we have staff from Senior Services and Long-Term Care, Shelter Support and Housing, Parks, Forestry and Recreation, and Municipal Licensing and Standards. The first question is to Janice Golding from CTV News. Janice, go ahead, please.
Hi, Mayor. This morning on CP24, you mentioned that you thought that there might be more people going to the lakes because of COVID. They're not able to leave the country to go on other vacations, or they might be limited by finances. And we saw 3 people drown over the weekend over at Bluffers Park Beach. We're just wondering if you think that there should be more lifeguards on duty. We know that here they're only on duty between 11:30 and 6:30 p.m. If you're considering that, or more signage, or any other safety measures that you might be considering at this moment.
I should say that what happened on the weekend was a very big tragedy. Anytime we see preventable loss of life like that in our waterways or in our bodies of water, including one as big and challenging as Lake Ontario, it's a very sad occasion indeed. I would be prepared to see us take a look at that. We have obviously put those resources in place over time for the most frequently used times, or the times when those beaches and water areas are most frequently used. And there are also guides in place to show people the areas in which it is best for them to swim in the context of safety, given the lifeguarding. It's obviously something that we should take a look at in light of these tragic incidents this weekend, and we will. But I can say no more than that at this point in time. We haven't actually had that discussion as yet or made any decisions.
Were you personally shocked when you found out that 3 people had there were 3 separate incidents within less than 3 hours on the weekend in the same area?
I think we've often seen this, unfortunately, with tragedies in the water, that they sometimes occur, in particular conditions and at particular times. I'm informed that these particular tragedies, which are all in themselves tragedies and taken together, happened at a time that was beyond the normal lifeguarding hours. Hence, a willingness to take a look at those hours, although they've been carefully chosen over time. And also, I believe, in at least one of the cases, if not more, took place outside of the directly supervised swimming areas, which means a much bigger challenge for us in terms of being able to respond. And certainly, I will say we did, I think, a very good job with all of the resources of the fire department, the Marine unit, the Coast Guard, and others of trying to respond and save people. But it becomes challenging the further out you go, and the differences in time periods that these things happen. But they're a tragedy nonetheless, and I think you always want to look for ways to see if you can do things better, and we will do that.
Okay, thank you. We go next to Lauren Pelley from CBC News. Lauren?
Hi, this is for Dr. Dubé. I'm hoping that you can comment on a particular issue that we've been looking at is supply teachers and any teaching roles that bounce around between schools potentially in Ontario. There's growing concern about possible, fueling COVID-19 transmission because of that movement, just like we've seen in long-term care. The province has not agreed to any outright ban on this type of movement, so I'm just looking for your comment on if you think that more should be done to limit that movement between schools.
Thank you for the question about supply teachers and their risk for COVID transmission. I think we haven't seen any protocols yet, and we're certainly waiting for further guidance on some of these specific issues. I think what I can say is from a public health perspective, the guidance that we've given so far to school boards has been to think about how to minimize risk. And so, for example, we've given guidance for teachers who may, for example, teach a subject like French, who may go into different classrooms. How can they still teach but do it in a way that lowers the risk? And so that would include things like making sure the teacher maintains their 6 feet physical distance from the students at all times, other PPE measures that the teacher could take as well, making sure that they're screened before they start their classroom. And another really important thing is actually keeping track of which cohorts the teacher has been involved in. Certainly, there are measures that can be put in place to minimize the risk. It would be best to limit teachers' involvement with specific cohorts, but where that's not possible, I think there are public health measures that we can try to put in place.
Thank you for that. Just a different question for Mayor John Tory. This one is from my colleague Natalie Nanowski. Just looking at the Toronto Police Services Board meeting tomorrow and the recommendations for police reform. Can you just talk about some of the reforms that will be discussed and just what you think are sort of the really key ones that need to be focused on and why?
Well, there's quite a wide range. I think in terms of allowing people to make better judgment on how resources are currently spent, since budgeting has been a significant issue, the transparency of the budget, which I believe we're going to take significant steps on in the coming days, if not hours, will be helpful, and that'll be something that is unprecedented in terms of what will be done. We will move to address, I believe, the recommendation coming to direct the police service to use existing resources, not increase the budget, but at the same time to dramatically increase the number of mobile crisis intervention teams to help us deal more effectively with mental health cases, and to similarly keep that expanded service to 24/7 all days of the week in all parts of the city in 2021 without an increase in the budget for 2021. We will begin the work, which is hard work and complex work, but nonetheless will be done expeditiously if you look at the reporting dates, to look at the reallocation of responsibilities from the police to perhaps people better suited to handle, for example, on a permanent basis, mental health. We will be looking at some of the specifics that we've asked the province to take a look at, which can include ways in which we can better make more transparent the disciplinary process for police officers and the types of conduct that are covered by that, and what the conditions are when people are facing disciplinary actions, including a broader latitude to suspend people without pay, for example. So it's a very long list. I think it goes to 80 recommendations. I believe that while this isn't the end, it is just the beginning. I believe all of these measures in those 80 recommendations represent significant steps forward to enhance policing, to transform policing, and to rebuild trust that has been eroded over time in various different ways.
Okay, thank you. We go next to Mark McAllister from City News. Go ahead, Mark.
Thank you. A question to Mayor Tory. Mayor, you, from the very beginning of the launch of Cafe TO, have considered it a success, and the number of patios that have been rolled out across the city. Obviously, distancing guidelines have been key. Another key component that has been mentioned, though, is accessibility. We've made our way around the city. Advocates have as well, have said that they've observed some of these asphalt ramps off the curb. However, many of these patios do not have them. why would it not be mandatory at the time of setup with the help of the city to make sure that these patios are accessible?
Well, I believe it was mandatory, but I know what you're saying, which is why wasn't it done concurrently so that at the very moment when the barriers were put in place and the things that created the sort of patio space on the curb lane were put in place, that the ramp should have been done, and I expect in many cases that was true. But I thank City TV for bringing to our attention the fact that there are some, and I trust that we have been provided with this information. If we haven't had a chance to look at every one, we will now proceed to take that information and to deal with that, because there are still plenty of weeks left in the Cafe TO program. And I will say that without making excuses about why some of those ramps aren't in place, and hopefully they will be very shortly, the program, I believe, has been an overwhelming success, both in terms of its popularity with the public, because I've heard about that loud and clear, but also, just as importantly, in terms of providing a much-needed assist to really hard-hit bars and restaurants that have had a terrible time during the pandemic, and that have had a double win here in that they've had more places to allow people to sit outside and enjoy the summer, but also more revenue opportunities. So I think the program has been an overwhelming success, and I would say the speed with which it was implemented would allow us some latitude in terms of getting these things done, perhaps a bit later than they should have been, but nonetheless, I think we got these in place very quickly, and we'll now make up for lost time with respect to the ramps where they don't exist.
Maybe I can ask Jody Callan from Transportation Services if she has anything to add on that. Jody?
Hi there. Thank you very much. Yes, we are currently continuing to install the asphalt ramps. We're going BIA by BIA. We have them planned, and we do intend on doing another big push this week to get them installed in the correct locations.
Thank you, Jody.
So just to clarify that, so this is still a proactive approach rather than based on complaints only and getting out there after the fact?
Yes, that's correct. In some cases, we wanted to allow the restaurants to have some time to operate, so we could make sure that we were putting the ramps in the most optimal places, and we're finding that information out now.
Did you have an actual second question, Mark?
Apparently not.
Okay. All right, thank you. We'll go now to Talia Giguère from Radio Canada. Talia, go ahead, please.
Hi, Mayor Tory. So I'm going to ask you the question in English, but would it be possible to have maybe a few words in French, please?
It depends on the subject matter, but yes, I can try my best.
Yeah.
You know, my facility is what it is.
Awesome. Yeah, thank you very much. So photos have been taken this weekend at the Yorkdale Shopping Centre showing a high volume of customers and a crowded parking lot. So are you worried about the gatherings of people in shopping malls in regard to COVID-19?
Je pense que beaucoup des... qu'est-ce que c'est le mot? Beaucoup des magasins adoptaient les règles et les adaptations dans l'intérieur de notre... leur magasin. Et je pense que ce n'est pas un grand problème, mais si vous ou les autres ont les détails comme ça, je suis d'accord d'examiner cette information et adopter les autres provisions si il est un problème. Mais je ne sais pas que c'est un problème maintenant. I will just say, we have relied on the advice of our public health officials with regard to this, and I think a lot of the malls have undertaken many different measures, both in terms of rules and in terms of directional signage and so on they've put on their premises. And as yet, I have not had it brought to my attention this is a problem. But if there are specific instances in which people think it is a problem, then they should bring it to our attention. We will discuss it with public health, and if there are new steps that need to be taken or additional rules that need to be put in place, then we will obviously consider that.
Okay,
I hope in one language or the other you can make some sense of that answer.
Yeah, that's perfect. Thank you. And my follow-up will be, what are these measures that the city could do to ensure more social distancing and respect, like in the mall?
Well, I mean, I've seen with my own eyes the measures they've undertaken to cause people to walk in different directions. I mean, normally in malls, it's kind of a free-flowing affair where people walk as they wish, and they're kind of not very, very organized. And the malls that I've been in, which are only a couple, have been very organized in terms of one-way directional arrows and so forth, and people using one escalator as opposed to another, and these kinds of things, staircases that are clearly marked. So if there's a problem with that, it's either because people are not complying or because there are too many people at a time in the mall. And of course, in the stores, they've been trying to control that as well. And so I would just say that at the moment, I'm not saying anything additional is necessary because no one has brought to my attention prior to this question that there's a problem. If there's a problem and it's brought to our attention in a way that is specific, then we will take a look at it first, I suppose, by talking to that landlord or mall operator and seeing if there is any particular reason why it's a problem, and in fact, if it is, and then secondly, discussing with them what we could be doing about that. As a problem of general application, as I say, in the absence of hearing anything about it, I don't see it as a problem of general application, because we generally hear about those from people or from store operators or from mall operators themselves, but they just haven't brought that to our attention. No one has, including the public.
Okay, thank you. Final question is to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hey there, welcome back, Brad.
Thank you.
My first question is to Dr. Dubé. I'm just wondering if you could speak a little bit to the formation of the team of public health nurses. I know the mayor noted it's around 70. I just did some quick math, and that's maybe a nurse for every 11 TDSB or Catholic District School Board schools. So I just wanted to find out a bit more about the capacity and how that team will be distributed amongst the boards.
Oh, thank you for the question about our school health team and the new nurses that will be hired. The new nurses will be added to some of the individuals that we currently have related to our school health team. And so it will include providing resources for mental health and well-being, for infection prevention and control. We are currently looking at how to implement this across the city, including what will the model look like. We are looking in particular at certain areas of the city that have had higher cases of COVID and providing additional supports in some of those areas, especially since the nurses' main focus is on COVID prevention and some of the training and maybe facilitation for testing. So more to come on this. It's an active file, and we're certainly trying to figure out what's the best way to utilize these resources, given the number of schools in the city.
Okay, great, thanks. And then just secondly, also on schools, probably for Mayor Tory, I think, unless there's staff on the line that can speak to it, but just wondering about any progress in trying to help the school boards in Toronto find additional space, given that the capacity issues in each classroom are of concern. And I'm sure I've certainly talked to friends who are teachers who are already struggling to imagine, distancing 15 of their students when they have a class of 30.
So I had quite an extensive presentation that I received this morning on this subject, and as we've mentioned, there have been discussions ongoing for some time about what the city could do. That was based on an offer I made weeks ago to say that if we could be of some help, that we would try to be. This is obviously a complicated matter for us, given that we operate that space with programs in it, whether it be library space, community center space, or other kinds of spaces. And so we have to examine within the context of what we're offering to the school boards, what impact that would have on our service offering. And obviously we have discussed this morning and previously the fact that the safe return to school is of paramount importance to families and to the kids in particular, and to the school boards and teachers. And so we're engaged in those discussions now, and actually down to the point where we actually are discussing specific availabilities with them. And so before we report to the public on what we could do, we wanted to sort of tell them what we thought was possible, which is quite an extensive offering of different kinds of space, including, as I mentioned, obviously, a very open use of the parks without permits. And we would expect that within the context of both our issues we have to sort out, which are, say, programming related, and their needs that they will have as to whether they could use any or all of this space or more, we will have more to say on that in the coming days.
Okay, thank you for joining us, everybody. That concludes today's briefing. We'll be back here again on Wednesday, the 19th of August.